Hi everyone, we're going to go ahead and get started. My name's Olivia again, and I'm going to introduce our speaker today, Claire Fitch. Claire manages the Food System Policy Program at the Center for a Livable Future, which is an academic center based at the Johns Hopkins Bloomberg School of Public Health. Her work focuses on the public health and environmental impacts of food-animal production, as well as food procurement and labor issues in the food system. And she has an MSPH in Human Nutrition from Johns Hopkins School of Public Health. Claire's talk today, Food Production, Labor, and Risk, the Public Health Case for Immigration Reform and a Better Food System, will introduce a new CLF report that reviews the public health threats facing agricultural workers in the U.S., especially focusing on immigrant workers and their families and due to the inherent risks that are in that area. So with that, I'm going to hand it over to Claire. We'll get started.
All right, thank you. Can you guys hear me okay? Awesome. Thanks for coming, and thanks to the organizers of this fantastic conference. It's a very necessary conference right now. My name is Claire Fitch, and I work in the Food System Policy Program at the Center for a Livable Future. I'm here today to speak on the health risks that agricultural workers, and particularly undocumented immigrant agricultural workers, face day to day, and to make the case for several policy changes and ultimately comprehensive immigration reform in order to protect agricultural workers and the safety and security of the U.S. food system. So the Center for a Livable Future is based at the Johns Hopkins Bloomberg School of Public Health, and as Olivia said, we're an interdisciplinary academic center. So we are technically situated in environmental health and engineering, but we have faculty at the center in departments across the Bloomberg School of Public Health, and we also collaborate across Johns Hopkins University fairly often. We're celebrating our 20th anniversary this year, and so we've been doing education, research, and advocacy activities related to the food system, mostly with a domestic focus. And we work at the intersection of public health, diet, food production, and ecosystems. Some of the issues that we most often work with include the production of animals for food, community food security. So we provide a network for food policy councils all across the United States. We also work a lot with food waste and recovery, and with research related to dietary patterns and climate change. I'm here today to speak on a new report that we're releasing on looking at public health, immigration reform, and food system change. And I want to note that many of you have been working in farm worker and labor issues for many years, and this hasn't been a primary focus for CLF. We're kind of new to this area. But we recognize the vulnerability of immigrant agricultural workers, and we thought that by illustrating the health risks that these workers face, and at the same time demonstrating the food system's dependence on these workers, and therefore all of our dependence on these workers, we believe that we could add an additional rationale to the case for immigration reform. So kind of further carve out the food systems and public health angle in the case for immigration reform. So a little bit about what's ahead in this presentation. I'm going to provide you with a little bit of background on U.S. farm workers and agricultural workers. And just a quick note here, I'm using the term agricultural workers to denote both farm workers and crop workers, but also people that work in slaughtering and processing facilities. We'll also do an overview of health risks associated with agricultural work, with particular attention to immigrant workers and the increased vulnerability that they experience to many of the health issues that I'm covering today. We'll discuss the barriers to public awareness of the risks that agricultural workers face and the effects of these issues on the safety and stability of the U.S. food system. And we'll close with policy recommendations to try and address some of these issues from a public health standpoint. So farm workers in the United States, the advocacy organization Farm Worker Justice estimates that there are about 2 million workers, farm workers in the United States right now, and that about 80% of them are immigrants. 50 to 75% of them are undocumented, meaning that they lack citizenship or temporary work visas. And according to the U.S. Department of Labor, hundreds of thousands of more people are employed in the slaughter and processing facilities that are an integral part of our agricultural system. Yes? Uh-huh. No problem.
Just slightly slower.
Sure.
2 million farmers, what is the percentage of the immigrants?
80%.
Thank you.
50 to 75% are estimated to be undocumented. The figures for that are kind of all across the board, though. So crop workers specifically, every few years, the Department of Labor conducts a survey, a nationwide random sample survey of crop workers in the United States. It's called the National Agricultural Worker Survey, or NAWS. And the survey is limited for several reasons, one of which is that it doesn't survey workers with a temporary employment visa. It also requires that the employer or the farm owner gives permission for their workers to be surveyed. So we're missing a lot of people in this survey. I want to point that out. But it still provides us with a look, maybe a close estimate of some of the demographic statistics of crop workers in the United States. It found, the 2011-2012 survey found that about 48% of crop workers are not authorized to work in the United States. Many people estimate that 70% or more crop workers lack citizenship and work authorization. Roughly 1/3 are US citizens, 18% are lawful permanent residents, 71% are immigrants, this is crop workers only, and the vast majority of workers captured in the survey are from Mexico. Spanish is the most dominant language for 70% of the workers, and 57% speak little or no English. The average total income, which you've heard already this morning, is between $15,000 and $17,500. And that actually includes income that some crop workers are earning outside of agriculture. So we'll get into the health risks that these workers face, and this will be kind of a brief overview of several different areas of research. So pesticides, there are two types of pesticide exposure. There's acute exposure, which can occur in a single instance, and there's chronic exposure that can occur daily, monthly, weekly, maybe over periods of years. And each type of exposure has its own health implications, including respiratory and skin conditions, the development of certain types of cancer, neurologic problems, reproductive disorders, and cardiac, liver, and kidney conditions. This kind of affects every part of the body. Recent studies have shown a link between pesticide exposure and chronic effects such as obesity and diabetes as well. Several types of childhood cancer have been linked to environmental exposure to pesticides. So this could happen in farm worker children that live near pesticide spraying, or it could happen if parents are have experienced occupational exposure either during or after pregnancy. The EPA also estimates that there are between 1,800 and 3,000 preventable pesticide poisonings of workers every year, and they acknowledge that this is likely an underestimation. Or that there's underreporting. Underreporting can result from several different things. It can result from farm workers not seeking health care in the United States or consulting providers outside of the United States. It can also result from the misdiagnoses of pesticide poisoning or healthcare providers' failure to report pesticide poisonings to the appropriate surveillance programs or health officers. And one of the most important barriers is that pesticide exposures can take a really long time to manifest as illnesses. It can take decades. And once there is an illness present, it's really difficult to trace that back to a certain instance of pesticide exposure. But despite these barriers to accurately estimating pesticide exposure, crop workers are considered to be at risk for exposure and for pesticide-related illness. Production agriculture involves labor, heavy machinery or dangerous machinery, and exposure to other hazards that place workers at risk for injury and even death. In 2013, the agriculture, forestry, fishing, and hunting sector reported the highest fatality rate of any industry sector, and that was 22.2 per 100,000 full-time employees. In 2012, it's estimated that 374 agricultural workers were died from a work-related injury. So 374 died from a work-related injury in 2012. Every day, 167 agricultural workers are injured to the extent that they're unable to work, at least temporarily. But here too, there's probably underreporting. A recent study attempted to quantify the US government's underestimation of injuries, and they found that as many as 77% of agricultural work injuries may have been missed. So that's 74% in crop production and 82% in animal production, injuries that were just never reported and were completely missed. Workers who do not speak English may be at higher risk for injury, as farm owners and employers may believe they're providing adequate training and safety information, but the information may not be sufficiently available or comprehensible to employees. Agricultural workers can suffer from extreme heat, cold, and other environmental factors, and they may have limited breaks to go to the bathroom and limited access to potable water. At the same time, typical work activities include stooping and bending, as you see people doing in this field, and performing repetitive motions that may contribute to chronic musculoskeletal problems. A 2014 study of the association between agricultural work and chronic pain among agricultural workers, Latino workers in California, found that chronic musculoskeletal pain is prevalent among workers and is influenced by their work positions. So air quality. Farm workers and meat processing workers are routinely exposed to air that's contaminated with particulate matter or dust, volatile organic compounds, or what we call VOCs, harmful bacteria, toxins, odors, and other harmful substances. In California, where about half of all of our fruit and vegetable and nut production occurs, studies have shown that workers have decreased respiratory function and increased respiratory symptoms like chronic cough and wheezing, and they also have increased mortality rates from chronic pulmonary disease. Another air quality issue can occur when untreated animal waste is applied to fields that farm workers later work in. So, for instance, salmonella introduced by manure can survive in soil for up to 230 days, placing field workers at risk of contracting an infection. Workers in animal production are also exposed to various airborne pollutants and harmful bacteria such as Campylobacter and Staph aureus. And these can contaminate both the air inside animal housing and the surrounding environment through ventilation systems. So what you see here are huge ventilation fans at the end of a chicken broiler house on the Delmarva Peninsula. There are unique air quality factors in different settings, and that, coupled with a fast pace of migration of workers to different agricultural jobs, and the likelihood that workers are exposed to multiple agents, makes it really difficult to characterize an individual worker's cumulative risk of health problems related to poor air quality. Animal waste naturally contains nutrients and bacteria, just like human waste, but because of the feed that animals are fed, it also contains drug residues, heavy metals, and antibiotic-resistant bacteria that can affect the health of people that come into contact with waste. An estimated 314 million metric tons of animal waste is generated on U.S. farms each year. And with animals being concentrated to geographic areas that are really too small to absorb the wastes of animals, many animal production operations, and particularly large dairy and swine operations, now rely on water-based slurry systems to flush manure from the floors of animal houses into large storage ponds. So you see that on the bottom left. These are often called lagoons. Workers can inhale airborne waste particles when they're working in, like the guy on the top left, when they're working inside an animal house or when they're working around animal houses. And they can also come into contact with animal waste when they're removing waste from these houses or when they're transporting or spreading manure. So what you see in the top right is actually swine waste being sprayed on a field for fertilizer. This is problematic, right? Because manure, as I said, contains a whole host of potentially harmful bacteria and substances that workers are then exposed to, and they can carry those bacteria and other contaminants back to their homes and their communities. Animal processing plants, they're designed for rapid slaughtering, cleaning, packaging of animal products, but the conditions are often very unsafe. They involve loud noise, sharp tools, dangerous machinery, and chemicals in very hot water for cleaning. And they often require workers to perform very fast-paced, repetitive, and forceful tasks that can result in injury very quickly. The most common injuries in processing plants are cuts, strains, cumulative trauma, and injuries sustained from falls. The more serious injuries, like fractures and amputations, also occur. About 29% of workers in the meat and poultry industries are not U.S. citizens, and there's a lot of exploitation of processing workers. particularly in the poultry industry, which is concentrated in rural areas in the Southeast and in the Midwest, where there's really low labor costs. In these places, particularly where poultry production occurs, there's typically limited unionization, there's a lack of social services in place for the protection of workers' rights, and there's very few employment alternatives. So once workers are in the system, they have few other options. Social and mental health impacts of agricultural work could really be an entire presentation in and of itself, but I want to say quickly that there are many aspects of agricultural workers' lives that may contribute to high rates of psychological distress, substance abuse, depression, and suicide. Workers typically have a very low income. They have limited education oftentimes. They have a lack of medical care, poor working conditions, substandard housing, and frequent migration between jobs. Studies have also found that food insecurity affects many farm workers, with rates of food insecurity as high as 82% among migrant and seasonal farm worker households. The health effects of working in food production and processing often follows workers to their homes and their communities. Family members and communities of agricultural workers can face pesticide exposure, poor air quality, and contaminated water. Sometimes to the same extent as the workers themselves if they're living near where the farm worker is working. Multiple studies have found pesticide metabolites in the urine of farm worker children, which is associated with decreased mental development, all sorts of attention disorders, and other pretty serious health problems. And as I said earlier, animal production is often concentrated in rural, very low-income areas. And researchers have predicted that the fear of reprisals or retaliation probably discourages residents in those communities from reporting things like bad odor or health problems that they think might be tied to animal production in their communities. Farm worker communities also frequently experience housing and sanitation issues, which affect worker health and hygiene. In many cases, there are no laundry facilities in homes, there's poor ventilation, and plumbing is inadequate or non-existent. So if you think of coming home with clothing that's covered in either bacteria or pesticide spray, and there's nowhere to wash it, that becomes a problem. Sometimes the living and working conditions that undocumented workers face quickly cross the line into slavery and human trafficking, and that's something that's covered extensively in our report. For immigrant, rural, and undocumented farm workers and meat processing workers, there are often additional challenges to finding adequate representation, healthcare access, and legal protections. Lacking the right to vote, undocumented workers may have difficulty finding elected representatives who are willing to advocate for their fair treatment. There are several examples of agricultural exceptionalism in the law, whereby agricultural labor is not subject to the same regulations as the labor in other sectors. Farm workers are typically not covered by workers' compensation in many states. They're typically not entitled to overtime pay under federal law. Youth agricultural workers are exempt from the child labor provisions of the Fair Labor Standards Act. And farm workers are not covered by the National Labor Relations Act, which effectively eliminates their right to collective bargaining. Immigrant workers also face they lack good access to health care due to physical, financial, and linguistic barriers. And the Affordable Care Act may actually further exclude certain agricultural and meat processing workers from obtaining health insurance because temporary and undocumented workers are excluded from the subsidies that are available to all other workers. This limited access to health care may contribute to the underreporting and lack of awareness of work-related injuries, illnesses, and conditions of exploitation and abuse. There's also a litany of issues with guest worker programs in the United States, and that's what we call the H-2A agricultural visa. It's been found to suppress wages and contribute to human rights violations. And there's several challenges to litigating on behalf of agricultural workers, particularly undocumented or migrant workers. Some of those challenges include workers' fear of deportation, the difficulty in some cases of proving causation, and also arbitration clauses that are in employee contracts. We'll switch lenses for a minute and look at how these problems could affect most of us, the consumers of the US food system, in addition to workers. And we would argue that the US food supply is insecure as long as it relies on an impermanent, underrepresented, and at-risk workforce. And it's obvious that the health issues that are affecting farm workers and meat processing workers might affect food safety, right? We want the person who's picking our lettuce or packaging our chicken to be able to take bathroom breaks and to wash their hands with soap and clean water. But we also know that there's already a labor shortage and that each of the 2 million farm workers in the United States right now are vital to building a reliable and safe US food supply. So if 50 to 75% of those workers are undocumented and are facing an unreliable future, what are we all facing as consumers of the US food system? In our report, we argue that a path to citizenship is necessary in the long run in order to ensure a stable workforce and protect both the workers, both the health of the agricultural workers and the stability of the US food system. We also made several specific intermediary policy recommendations, including providing health insurance to all agricultural and processing workers through the Affordable Care Act or other state subsidy programs. Revising the Fair Labor Standards Act to require overtime pay and minimum wage for all agricultural workers. Mandating that employers provide workers' compensation coverage for all agricultural and meat processing workers. These laws vary by state, and as of now, migrant and seasonal workers are not guaranteed sufficient workers' compensation coverage in about half of all US states. Another is expanding and increasing funding for the CDC's National Institute for Occupational Health and Safety, or what's called NIOSH, and the Occupational Safety and Health Administration, OSHA, in order to conduct wider surveillance of these issues and enforce the regulations related to worker safety. We also recommended removing the exemption for the number of employees that are required for on a farm for the enforcement of laws and inspections. So a farm is currently exempt from all OSHA enforcement and inspection if it employs fewer than 11 non-family members. And given sort of the mechanization and the industrialization of agriculture and of some of these farms, you can produce a lot of food and you can run a fairly large farm with many fewer than 11 employees. Let's see. Ensuring that workers and their families have access to safe, affordable housing in the US. You could do this by establishing funding sources at the state level for housing specifically for agricultural workers. And finally, strengthening the enforcement of human trafficking and sexual harassment laws in agriculture. You could do this by increasing the number of Equal Employment Opportunity Commission offices in rural areas, making sure that there are Spanish-speaking employees on staff at those offices, and allowing complaints to be filed offline. It's a huge issue. Finally, improving the guest worker program by replacing the H-2A visa with a variation of the Blue Card program that was in the 2013 Senate bill for immigration reform. It's a visa that would allow workers to switch employers, to apply for a green card after 5 years, and to come and go from the US as long as 100 days of agricultural work are completed within a year. So in conclusion, as the immigration reform debate continues to evolve, we believe the public health community must continue to provide research and advocacy around the link between the health and security of agricultural and meat processing workers and the United States food system. The information that we do have on the impacts of industrial food production and processing, along with our absolute reliance on agricultural workers for our food, demands that the health threats and the living conditions that workers face be considered during any debate on immigration reform. And with that, I'll take any questions that you might have. Yes. Yeah. Yeah, I don't. We've covered that a bit in the report, which I can give you a copy of now. That really wasn't the primary focus that we were taking. But if you're interested, I can send you. I mean, I think a lot of advocacy groups are working primarily on that issue. Yeah, sure. Mm-hmm.
I have a question about, do you have a focus on what parts of the U.S. food system, particularly specific crops or specific types of nutrients in the U.S. food system, are most vulnerable because of our current immigration system. So I'm thinking, for example, I doubt corn production is particularly vulnerable to our immigration system, whereas certain specialty crops are much more vulnerable.
We didn't parse out food by food, but I will say that CLF and a lot of my work focuses mostly on communities and workers in areas where there's high levels of industrial food animal production. So we work a lot on antibiotic resistance issues, for example, and the waste issues. In terms of specialty crops and crop production, I'm not an expert at all. And so a lot of the reviews, I mean, we basically did a literature review, right? So a lot of the reviews didn't actually specify what crops they were looking at. And the NAWS survey is just of crop workers across all, all types of food. So I don't know if you could get through some of the surveys and the work that's been done by our government. I'm not sure if you could accurately parse out, but you'd have to dig a little bit more into specific research by crop. Yeah. Mm-hmm.
As part of your research, did you have the chance to talk to and see any community members and facilities, and could you talk a little bit about what that was like?
Yeah, sure. Yeah, so we're based in Baltimore, and I grew up in Maryland and travel to the Eastern Shore pretty frequently. My parents live over there. And on the Eastern Shore, the Delmarva Peninsula, there's a lot of broiler chicken production. I think it's about 300 million broilers produced on that piece of land every year. And it has the attention of a lot of people in that area because of pollution to the bay. Not so much on attention to the communities that live around those houses, those poultry houses, and the amount of pollution that comes out of those houses, and air pollution specifically. All that's to say that we work with some communities on the Eastern Shore. And I was able to travel around with an immigration specialist on the Delmarva Peninsula and talk to a lot of families, a lot of undocumented and migrant workers and their families who may spend part of the year working in poultry production, cleaning chicken houses, picking up dead birds daily, and then going to their family who lives in a trailer like 100 feet from one of these chicken houses. And I can tell you the smell is unbelievable, and poultry is way better than swine. So they're facing really pretty egregious odor problems, but they're also facing bacterial problems, and particularly antibiotic-resistant bacterial problems. So I definitely saw firsthand and talked to people through a translator that they're very, very reluctant to talk with people about this, right? She really had to assure the people that I was talking to of who I was, and that I wasn't, what I was doing with the information, and that I wasn't going to write specifically about any of them, and I wasn't going to name anyone. There's a lot of fear of talking to people. So I kind of got to see some of that firsthand in the living conditions that, it's amazing, that are right in the backyard of a lot of places where we live. Maryland is one of the richest states in the country, and this is like all underground. So it's really interesting. Yeah.
So I remember from the food
Yeah.
that how the conglomerates themselves were actually involved in systematically bringing in this undocumented immigrant workers.
Sorry, what was the government was, or?
Oh, no, so the
Corporations were.
Yeah,
Okay, right.
Corporations
Yeah.
themselves were actually
Yep.
were behind the scene in bringing in all the
Workers.
undocumented
Right.
to the United States.
Right.
And actually reporting them one after another to have their face with the with the government. I was wondering if this type of practice is still happening in the industry, or this was happening only 2 to 3 decades ago.
Yeah. I'm not sure, but I will say that I think there's actually a lot of odd bedfellows and advocates for immigration reform and for a more permanent workforce from the food industry. And that's one of the reasons we wanted to write this report, was to kind of try to maybe get buy-in from both sides of the political spectrum, because the president of the National Chicken Council has recognized that his industry is insecure until he has permanent workers. So So I think maybe if they're bringing workers in through the back door or legally through the H-2A visa program, I'm not really sure. I don't have a good sense of how much is occurring, how much they're involved in the behind the scenes kind of transfer of workers. But I will say that I think this is one part of the immigration reform issue where we can get a lot of buy-in from the food industry because they recognize the need for workers. Yeah.
Is there any other international reports that you can kind of compare from standards and see how we compare against other markets?
Not that I've looked at, not that I've seen, no. And if anyone in the audience has ideas for reports comparing our system to other industrialized countries or just across the board, I don't have a good sense of what's out there. Yeah.
We're about to launch a health campaign
Mhm.
on International Seed Day, April 26th.
Mhm.
And some of what you mentioned, statistics,
Mhm.
is kind of useful to use.
Mhm.
Is there any way I can get the slides or whatever?
Yeah, definitely. I also have copies of the report.
Of what you just presented?
I can send you the slides, but
That would be wonderful.
sure, yeah.
Couldn't take long.
Yeah, that's fine. I'll send it to you. Yeah, of course. Yeah.
Thanks so much for the presentation. I appreciated seeing all the policy recommendations for reform, and I was wondering if you are optimistic about policy as the path forward for this, and also what you think about non-state regulatory models.
Am I optimistic? Not in the next few years. So it's difficult because in talking with people about what recommendations we were going to make, and kind of like the keynote speaker pointed out today, you want to start with a big ask and work backwards from there, right? So we were like, do we recommend these intermediary policy changes, which we know some of which are problematic, right? They don't solve the problem, but some of these things don't require the federal government to be involved. A lot of them do, some don't. And some, in some cases there's examples of individual states carving out funding for housing programs, for example, that we want other states to adopt that because until there's change at the federal level or comprehensive immigration reform, something needs to happen. So I don't know if I'm optimistic about comprehensive immigration reform anytime soon, but I think hopefully, at a much more local level or at the state level, maybe some of these ideas could be adopted if there's funding for them. And what was the second part of your question? Non-state?
Just if you had a perspective on some of the non-state models that have been coming up for helping regulate issues such as farm labor.
So non-state meaning at a more,
At like the organizational level.
okay,
Coalition of the Lawfully Workers.
right.
They're not going through.
Right. In every discussion I've had with people about this, that's been held up as like the gold standard intermediary change. So I think highly of that program specifically, and I hope its variations of it are being adopted and implemented elsewhere.
I'd like to throw on people's radar the Equitable Food Initiative, which isn't out here, but it's a larger program out in the fields of California. It was started by Oxfam and several other players on the table, and it does a lot around pesticide education, the rights of organized farm labor workers, and food safety. And it's a farmer certification for farms that's recognized in the marketplace, specifically Costco, which is interesting. So that's one, I think, in addition to CIW, microjustice, that is worth looking into.
Yeah, another I'll mention is the Good Food Purchasing Program from the Center for Good Food Purchasing. This was started by the LA Food Policy Council a few years back, and it's now, it's basically a procurement guide, and it's been expanded now, and there's coalitions across the country that are trying to adopt these procurement guidelines at a city level. So Oakland Unified School District and LA Unified School District have adopted it, which I know that's West Coast, it's very different abilities that they have to procure locally and things like that. But the special thing about this particular policy is that it has labor standards. It also has nutrition standards, environmental sustainability standards, animal welfare standards, and local economies standards. But in talking with the people that run that program, they've said consistently that labor is the toughest portion of those guidelines to meet. Even in LA and you know, places on the West Coast that are beginning to adopt these standards, they're not meeting the labor portion of the guidelines. So, yeah.
I actually have a question maybe back to yours in comparing U.S. immigration, like agricultural immigration, or immigration policy around agriculture to other industrialized countries.
Mm-hmm.
I know, so while I was living in Middle America, there was a comparison in the communities between the ease of accessing the H-2A program and the ease of accessing temporary worker status in Canada and agricultural worker
Mm-hmm.
status in Canada. Do you have any implication or understanding of how those are our policies compared to Canadian policies and how that works out?
I don't know.
Okay.
Yeah. I'd love to learn about it, but I haven't compared them. Yeah. Yeah.
So, I think this ties in with the question of coalition building and standard setting organizations outside of the industry. I'm really interested in voluntary industry standards
Mhm.
that corporations set among themselves. I mean, often they are within their grasp, obviously.
Right.
But more importantly, it seems like, especially with what's happened with poultry in Del Marco, when
Yeah.
they've set voluntary industry standards, it's been looking outward
Mhm.
more at impacts on communities,
Mm.
forming contracts with poultry dealers about setbacks and vegetation buffers, things to protect the community from
Mhm.
the health risks that are within,
Mhm.
as opposed to looking inward and being worker-centric.
Mhm. Yeah.
First of all, is that, you're in the area and I'm not, I'm in the south, so
Mhm.
I could be totally wrong about whether all of those companies in your area are actually setting any sort of.
No, the only thing they're doing, I mean, Purdue has led the way on reduced uses of antibiotics and also on animal welfare standards, which both of those things indirectly affect workers, but it's the conversations, like you're saying, are from the community perspective, it's all about environmental pollution to the community, not to people working in the houses. So, yeah.
And since you are living in that area, can you just tell us, are the voluntary industry standards that are looking outward at community, are those actually making any difference? Are they being enforced? Are they being violated?
Tough to say. I mean, on antibiotics, so for the animal welfare standards, they really haven't been implemented yet. Purdue and I believe Tyson now has made commitments to phase in changes to the houses themselves that affect birds' animal welfare, but we visited Purdue a month and a half ago or so, and this is happening like in the single digits percentage-wise of all the houses that they have on the shore. So that's really hasn't begun yet. But in terms of antibiotic use, they've phased out most antibiotic use. And from our perspective, that's a very good thing for public health. It's not necessarily, I mean, it's been recent enough that there's no research on the Eastern Shore about whether we're actually seeing, reduced cases of infections that are resistant to antibiotics in the Eastern Shore. We don't know yet. And then in terms of setbacks and buffers and other environmental, I guess, mitigation strategies, from a public health perspective, a setback of 100 feet versus 200 feet, there's no research to say that that does anything. So maybe it's a step in the right direction, and it's good because more people on the shore are paying attention to it, but we don't know if the tiny bits of progress that have been made so far are actually having any impact. All right. Thank you, guys. Enjoy the rest of the conference.